0 to 10 was the scale. 10 is the worst, and you said it was at 12,
12, yeah.
before we met, before we started together.
Right.
Right.
And now you said that you've had 2.5 months
Yeah.
Yeah.
of 0, of no headache.
Of no headache, yeah.
Of no
he'll
migraine.
he'll have slight headaches that
Of-
have to do with
I'm sorry,
barometric pressure.
Of no migraine.
Right.
I mean,
No
I haven't
migraine.
even had headaches.
No
I've
migraine.
had like 2, maybe
No
up,
migraine.
up to 4 small headaches, but they go away,
But they're barometric pressure related.
and they're
we
just
think.
normal. Like
Well,
I
there's
assume
no
like
headache.
what everybody has.
Headaches are not normal, but I'll
Yeah.
just say that the migraine pain has been gone,
Completely.
completely
Yeah.
gone for 2.5 months, 0. And you
0.
suffered for over 20 years with these severe migraine
Yes.
pains.
Yeah,
It's-
and
Percent huge of reduction of the sensitivity in the skin.
I'd say like 60%
60%
reduction.
reduction. That's pretty amazing.
Yeah.
That's pretty amazing.
It is
And
for
how long have
reasons.
you suffered with that skin sensitivity for? Do you remember?
I am not a doctor going person, and I mean just because we've gone to the ER and stuff, it's not because of that. So I don't know. I kind of let stuff go. So everything with me has been decades.
So decades. How would you describe it? Was it just the hands, or was it hands and feet?
Feet and hands, and I mean it had gotten to the point where it was just made me ill.
Mhm.
I mean, because I always had the feet and hands. I mean, white. I mean, just no blood,
Mm.
basically, in my hands and feet. But I mean, it got to where even going down the freezer aisle, I start to feel kind of sick.
Mm. You'd actually feel sick. It wasn't just like
No,
you in
it
pain
was-
or foot pain. You felt,
Yeah, it wasn't just the hands.
you felt
and
like
feet,
you
it was
might pass out, or you felt like a hard pain, or you felt nauseous, sick. What else?
poison.
Poison. You felt poison. Your body
Mm.
just felt ill.
Yeah,
And that Raynaud's now is,
Gone.
gone. Yeah, I don't
100%.
have that anymore at all.
and you're not having the sensitivity in the freezer aisle or
No,
in the
no,
freezer
not
in
at
your
all.
home.
No.
That whole sensation is gone.
Yeah.
Completely.
Awesome. So, but it was urgent and frequent.
Yeah.
But the frequency is decreased at night by how much now?
2/3.
Yeah, at least. Yeah.
2/3.
75%.
Yeah.
75% less at night
Mhm.
now.
Yeah.
So you can wake up maybe one time to go to the bathroom instead of more than
Right.
several times.
Right.
Fair to call tingling like a pins and needles kind of sensation?
Yeah.
It does. It felt kind of similar to when your hand falls asleep
And then
you lay
it's
on
waking
your arm
up
or
again.
something.
Mm-hmm.
Yeah,
And
similar
that's
to that.
totally gone
It's
now.
just a little bit different, but similar. Yeah.
And now it's gone.
Yeah, now
No
it's
more
gone
of
now.
that. Excellent.
Looked like I don't know if you've seen that Johnny Depp movie with the pirates of the Caribbean.
Mhm.
That's kind of, if anybody's seen that, that's what I was like.
What do
like
you mean?
like Jack Sparrow. He's always like.
Oh,
walking
right,
around,
yeah.
I'm
Like a
walking, I'm
Right.
falling, and then and everybody's like, "Wow, he's drunk or something." And no,
That wasn't.
I'm just walking.
And that's not at all. Now that sensation is,
Yeah. Oh yeah. I don't have that at all.
He would
I
have to.
totally-
He would have to grab a hold of things to steady himself. He hasn't
Right,
done that
Right.
totally
since our
gone.
treatment.
Totally
no.
gone.
Yeah.
Yeah.
0.
Gone.
Right.
Totally.
It's like you just don't want it there
Mm.
at all times. You know what I mean?
You just don't want any motion, any noise, any light, any yeah.
It's hard to describe.
Right. He's certainly more social than he was 6 months ago.
I can see that right now.
Yeah. I mean, you didn't need me for this at all.
I know. I see that too. The brain fog.
When you got a beautiful wife like this, you can't. You don't.
Let's
You
stop.
don't like get on the video without her.
What is the brain fog though?
Yeah,
that the same or is that decreased?
is probably the biggest. Well, I mean, I don't know. I really can't say which thing has been the most helpful, but that's been huge. And my memory is just almost non-existent when we came in. It was getting to where I started to get
You would
concerned.
he would ask me questions in the same conversation multiple times, same question, as though he were in a different stage of life,
Yeah,
consistently, and that's gone.
and we were,
He's almost
it was-
remembering too much
yeah.
for my liking.
Yeah.
So it's great. So the brain fog is gone. You also told me that and you were misdiagnosed as a Parkinson's disease.
Yeah.
Hello, do you suffer from chronic pain or chronic fatigue and chronic illness or chronic disease that you've tried many different doctors and different types of supplements and different practices, different types of health recovery type programs that haven't provided you relief? Well, then this video is for you. My name is Dr. Lonnie Herman. I'm with two lovely, one patient and one soon-to-be patient. This is Mr. and Mrs. Nemeth, who live a couple of hours from my clinic. And we are reporting to you after he completed his first protocol that he did at home after the first examination, which we did in my clinic back in June 11th. And today is September 10th, 2018. So I'd ask you both if first of all, how many years did you suffer? And you had various symptoms. So but even before we talk about the years, your symptoms were you had chronic headache pain, right? How long ago did your headaches start, and how long have they been going on for?
I mean, when you say headaches, there's migraines.
So a
Severe.
migraine, you had a headache and a migraine. Were they different for you, or was it migraine is the only
It
way?
was almost always a migraine, and I mean to the point where you get nauseous, the light, sound, everything.
So you had the photosensitivity, the sound sensitivity.
Yeah,
nausea.
just for people that are watching, saying you don't know what a migraine is. I know what it is, and yeah, that's what I had
And was
all
it
the
so
time.
intense that all the time, every day,
all the time.
Every day.
for how many years?
Live with it.
Decades. At least 10.
1986.
Is the first time that you remember having a migraine?
Yeah.
86 or 2018, so you're talking a couple of decades,
Right.
more than a couple of decades.
And that's why, I mean, I just have a real high pain threshold because of that, because of the constant.
Constant pain.
Like I've done things with other, mainstream doctors that don't actually help you. But I mean, done things and they're like, he's going to need a bunch of, I'm like, no, I'm good. And they do stuff and they're like, how did you withstand that? I'm like, my life is pain.
Mm. And that pain was 24/7 pretty much. And
All
you've
the
been to
time.
hospitals that have taken you to the ER, that kind of head pain?
Oh, yeah.
Oh,
Oh, yeah.
Many
yeah.
times.
Yeah.
Yeah.
Mhm.
And so now your headache pain, you have had, I think what you told me before we started the exam today in our consultation, the headaches were gone. You said your headache was at a 12. 0 to 10 was the scale. 10 is the worst, and you said it was at 12,
12, yeah.
before we started together.
Right.
Right.
And now you said that you've had 2.5 months
Yeah.
Yeah.
of 0, of no headache.
Of no headache. Yeah.
Of no
he'll have
migraine.
slight headaches that
Of-
have to do with
I'm sorry,
barometric pressure.
Of no migraine.
Right.
I mean,
No
I haven't even
migraine.
had headaches.
No
but
migraine.
I've had like 2, maybe
No
up,
migraine.
up to 4 small headaches, but they go away
But they're barometric pressure related.
and they're
we
just
think.
normal.
Yeah.
Like
Well,
I
there's
assume
no
like
headache.
what everybody has.
Headaches are not normal, but I'll
Yeah.
just say that the migraine pain has been gone.
Completely.
Completely
Yeah.
gone for 2.5 months, 0. And you
0.
suffered for over 20 years with these severe migraine
Yes.
pains.
Yeah, and I mean, I've done everything. And I've had sinus surgery twice, and the last time I told them, open me up. I don't care what, I'm not going to sue you, make the holes as big as you can in my sinuses and everything. And they were like, okay.
Because after 2 times it
No
didn't
help.
work, and then a 3rd time it didn't. And what else? Did you do other surgeries to try to relieve the migraines? Or was it just medications?
Constant medications. I mean, I've tried different things over the years, but I mean, I used to drink NyQuil every night. Every night. Not a capful. I've tried I don't even know, just tons of stuff.
Hmm.
Ibuprofen, go through the big bottles of it.
Mhm.
I really, part of the other problems I've had was memory, but so I really can't remember.
Mhm.
My memory's only starting to work right now, so,
It's starting to come back.
you know.
So you get a mild headache here and there. You've had a couple, 3 or 4, you said in the past, almost
Since
3
the
months.
treatment, yeah.
Since the treatment, not since we met first, so during those past 3 months? Or
Yes.
since you finished your first protocol?
Since he finished the first
Since
protocol.
the
Since I
first protocol,
finished
you had
is
3 or
when
4
I really
minor.
started.
3 or 4
Yeah,
minor
minor
headaches,
headaches.
and probably related to the fact that he feels so much better that he's overdoing it. He gets
Overdoing it.
dehydrated.
Because he's working outside
exactly.
now, because he couldn't go,
He
there was
couldn't
no
work
working
outside.
outdoors.
Right.
Yeah.
Mm-mm.
The headaches, the migraine stopped you from working outdoors?
Well, the
stopped you from-
migraine among
From
all
doing
the
anything.
other
Well,
symptoms.
we're gonna go over the other list.
I
Right.
haven't,
Symptoms.
yeah, I
But the
mean,
migraine stopped you working outdoors? There was
I
no
haven't-
like doing any gardening around the house? You
No,
couldn't do
no.
anything?
I haven't done anything in years. It's not just the migraines. It was just the whole,
The whole thing?
I
We're gonna
felt
go
like
over that
a-
list.
Mhm.
No riding a bicycle?
I felt like I was poisoned. So, I mean, there was there was no kind of, I worked a job out of having to, and having a work ethic and everything, but other than that, there was no kind of leisure, there just wasn't, because I just don't have it in me to, even though I would love to, I was a fantastic golfer, I think. But I mean, I can't do anything. And I mean, now after the treatment, then now I'm riding bikes and working in the yard, and
And so maybe overdoing it a little bit because he hasn't done work in so long. Or
I'm
ridden
just
a bike
on
in
you.
so long.
Exactly,
Yeah, I'm not
exactly.
used to
That's
the-
exactly
I
right.
was doing so much and not
Mhm.
even giving it more time to
It's-
recover. So a little
yeah.
mild headache came on.
Yes.
But that is nothing like what it was before. It's like
Mhm.
total solved.
Yeah,
puzzle.
it really
Right,
is.
oh yeah, it's
It
incredible.
really is.
You also,
Incredible.
you had a neck.
If I could get it, if it would be right for me to get up and hug you, I would do it. But
If you would get one.
if it wouldn't
To
seem
hug me?
weird, I'd get up and hug you. But
You will after this. We can do it. We're on the camera. Thank you. The neck pain, and this is reality. So this is reality for you now, that you actually have severe migraine pain relief.
Yes.
Oh,
And
yeah.
you're telling people that really it can happen for them.
Yes.
Yeah.
It really
So
can.
this is something that you found. I am someone who you found. And this is something that you found that actually helped you finally achieve
Mhm.
what you've been suffering, relief from what you've been suffering.
And we've
for
done everything.
everything.
Yeah.
Everything.
You
Yeah.
went through. You also said you had terrible neck stiffness and neck pain prior to
Yes.
working with me.
Mhm, mhm.
Is that neck stiffness and neck pain even existent now?
It's almost gone. I mean,
Almost gone.
yeah.
And we've done no therapies to your neck. There's no physical therapy.
No,
There's no
nothing.
chiropractic, no
No.
acupuncture, no massage, none of that. Just finding the pinpointing and
Nothing,
safely
yeah.
removing the hidden infections and toxins that were in your tissues
Mhm.
that it did. You also had one of your main complaints, in addition to the migraine, in addition to the neck stiffness and neck pain, you had skin sensitivity. You still have some, but you had an intense skin sensitivity. So
Yeah.
anybody could just like rub up against you or hold your
Mhm.
hand, or you putting on clothes, or what, laying with a blanket on or something.
I mean, everything was just not fun. I mean, the temperature, touching, everything was just kind of, and I got a whole lot of, I mean, I don't know if it's related, but cystic acne and stuff was really strange. I got that. I mean, I'm almost not getting that anymore at all now either. I mean, that's almost gone away.
Well, do you consider that the cellulitis?
I
No, they were
That's
two
a-
So that's
separate
two
things.
Totally separate. So, but
But the
skin
cellulitis
sensitivity-
too's gone. That's
Yeah.
gone.
I mean,
Gone.
like right now, I've got one, and
One,
I
I
mean,
see.
normally constant.
So,
And I mean, you can imagine how good looking I'd be without just that one. I mean, it's
So
almost
that,
hard
we're
to
not
believe.
doubting it. That's great. I'm glad you're feeling that good and confident and laughing. If you could have seen, I wish I would have had a video of the day that I got to discuss with him and interview with him and investigate with him and his wife. And the first time that I met with them before their first exam, there was no giggling and laughing and smiling and any kind of sharp, kind of funny attitude. It was not. You were almost, and I don't mean any disrespect
Go
or
ahead.
I mean, it was like almost like a zombie face coming in here. You
Right.
looked
Oh,
like
yeah.
a whole blank stare. You had a very fogged up brain.
Right.
Yeah.
And you couldn't even, she was doing more of the talking for you.
Yeah.
She's the one I think wroed the letter to me
Right.
describing
I
everything.
did.
Because you couldn't
Yeah.
even,
Well,
you
plus
couldn't even,
I thought you were going to charge a lot more, so I was kind of worried.
and I didn't. So it was fair enough
Yeah.
on that to be able to help you come in.
Oh my
here and get
goodness.
started.
Yes.
Yeah.
Incredible.
Yeah. And
So
that wasn't
you're-
just that day. I mean, that's just the way
Even since.
I was
Yeah,
all the
but
time.
you were just, it was a fog. It really was. So this is great. So, but the giggling and with the jokes he's making now, which is great. So we will hug after this. But that skin sensitivity, when we brought that up, you were saying that it was real sensitive, and you said, but you related it with the cystic acne
Yeah.
because it was it acne around the body or just on the face? Was the acne on the back?
I mean,
But you were sensitive if something touched your leg or something touched your arm or
Anywhere.
hand?
Everywhere. Yeah.
Anywhere.
Why did you relate that to the acne?
well, the only reason I'm relating it really is because it seemed like they both went away at the same time.
Gotcha. Okay, so the skin sensitivity, some of it is still existing. It's not totally gone yet.
Right.
So not totally away yet.
Not totally gone,
So-
but huge.
The
I mean,
huge difference.
You think it's like 10% is huge, or is 50% huge, or is 80% huge of reduction of the sensitivity in the skin?
I'd say like 60%
60%
reduction.
That's pretty amazing.
Yeah.
That's pretty amazing.
That's
And
the
how long
reason.
have you suffered with that skin sensitivity for? Do you remember?
I am not a doctor going person, and I mean, just because we've gone to the ER and stuff, it's not because of that. So I don't know, I kind of let stuff go, so
Mhm.
everything with me has been decades.
So decades. So you think over 20 years it's been with the skin sensitive
Oh
issue?
yeah, easy.
Even back to
Easy
like your
20
late teen years?
yeah.
Well,
8?
I mean, we traced his first tick bite back to 8 years old.
Mhm.
I mean,
So, but tracing it back then, was there pain back then?
the skin sensitivity, did you have that in Marine Corps?
I know exactly when I started to feel bad, and that was at like in between 12 and 13.
Mm.
I mean, I can pinpoint it exactly because I remember, like, wow, riding bikes sucks now.
Mm.
And I mean,
Really?
I just started to I started to go downhill from there,
So 35 years.
Wow.
and I just got to the point where we staggered in here, you know, I mean, and
Yeah. And so the skin sensitivity is way down, and the cystic acne is way down. Because I believe
Yeah.
that acne is coming from hidden infections in the body, and it shows that way through the skin. Sometimes there could be skin infections, but it's also the skin is an outer representation of what's happening on the inside. So we can clear up infections,
Sure.
whether it's an infection in the brain, the
Yeah.
stomach, wherever it is, and we remove that, it's going to go away. So that's awesome. You also, again, with the cellulitis. So the cellulitis was, how would you describe what that was like on your skin? Was it only on the face, or was it all around the body? Or other parts of the body, not just the face?
I don't think, I've had a couple small bouts on different, maybe like a thumb or something, or toe or something like that, but I mean, it's almost always on my face, and I had it one time on my entire head also. You know, I mean, my,
He almost lost his vision
I mean, yeah. Almost,
permanently.
almost went blind, totally.
Wow. And so now this
He
cellulitis.
was 17 when that started.
Yeah.
And there was no answer for it. You went to doctors for that as well, or you just
I
kinda
was in
dealt with it?
I was in Marine Corps boot camp at that time,
Sort of.
and they
ever-
kind of and it's weird. I don't know to describe the Marine Corps, but they do weird things. But I had to the point where my head was it started to look like a basketball, and I said, you know, 'cause every day, you want to go to the sick bay? No, sir. And then finally they were like, look, you got to go. We're going to lose our job. So.
So go.
And then we went and they said, yeah, he's going to lose his vision, and then, you know, he's going to die. So we need to.
What did they
And-
do?
They
give you
put a
shot? They
spike-
give you some
Well,
pills?
I had there was
No,
a
no
lot
pills.
of doctors came through, tried to give me a bunch of different things, and then finally a little Indian doctor came in and he said, oh, no, that will not work for his situation, and then
He did
you know.
something, but he gave you something?
he
And it
told
helped.
them some kind of concoction of different antibiotics and
So
stuff.
it helped reduce it.
It's kind of like a MRSA thing when it gets to that point. Like, you just can't.
But then they put a spike in your face.
Oh, yeah, I had like minor surgery with
Oh,
no
yeah.
anesthesia. Because I couldn't have anesthesia because they said it would, at that point, I just couldn't have it.
Hmm.
And so they did like they put like a metal spike up through my
To
lip
drain the infection.
and then lifted it up, you know, cut
Was
this
that
here.
It took
with
'em
infection?
twice.
And then hammered it with a big brass hammer through my face.
Wow.
And
It
And
took them
so-
2 times
It
to
was
get
super
in.
So
pleasant.
now in
I
this
really
round, I
enjoyed
think you told me before we started that it's been almost the same time, like 2 months or 2.5 months.
Yeah, he hasn't had one
You
single.
haven't had one bout.
Mm-mm.
And
No.
that was something that was pretty
And
constant.
as a matter of
It
fact,
was, yeah, we had it all the time.
it's very severe, and it starts, and then we know I can feel it. I can feel it through my whole body, and I know what's going to happen. And it actually was starting to happen when we came the first.
Evaluation. The
evaluated
day
us.
we were being evaluated.
And I mean, you gave me like some treatments and stuff right then. And when we left here, we were like, oh, I mean, any couple hours we're going to have to head to the ER, and then it went away.
Hmm.
And that's never.
And it's never
happened.
happened. That never
Never.
happened, and it
Never.
hasn't come up at all in the past couple of months.
Never.
Mm-mm,
Nope.
Awesome.
No.
You also talked about the Raynaud's phenomenon.
Gone.
So your
Right.
Raynaud's, how would you describe it? Was it just the hands, or was it hands and feet?
Feet and hands, and I mean, it had gotten to the point where it was just made me ill.
Mhm.
I mean, because I always had the feet and hands. I mean, you know, white. I mean, just no blood,
Mm.
basically, in my hands and feet. But I mean, it got to where even going down the freezer aisle, I started to feel kind of sick.
Mm. You'd actually feel sick. It wasn't just like
No,
in pain
it's-
or foot pain. You felt,
Yeah, it wasn't just the hands.
you felt
and
like
feet,
you
it
might
was
pass out, or you felt like a hard pain, or you felt nauseous, sick. What else?
poison.
Poison. You felt poison. Your body
Mm.
just felt ill.
Yeah,
And that Raynaud's now is,
Gone.
gone. Yeah, I don't have
100%.
that anymore at all.
and you're not having the sensitivity in the freezer aisle or
No,
in the
no,
freezer
not
in
at
your
all.
home.
No.
That whole sensation is gone.
Yeah.
Completely.
Awesome. You also mentioned that the urination, the frequency with your urination, because you've had like we can call it, possibly diagnose it as either we can call it overactive bladder or an interstitial cystitis. Maybe that'd be more proper because you had an urgent, you still get an urgency sometimes, but the frequency at night has reduced. So, but it was urgent and frequent.
Yeah.
But the frequency is decreased at night by how much now?
2/3.
Yeah, at least. Yeah.
2/3.
75%.
Yeah.
75% less at night
Mhm.
now.
Yeah.
So you can wake up maybe one time to go to the bathroom instead of more than
Right.
several times.
Right.
Yeah.
The edema you had in your body,
Mm-hmm.
that is?
He doesn't have it around his wrists anymore.
Yeah, I mean, I've had it.
His
I mean,
ankles
it
a little
gets.
bit.
It's. I mean, you could push on my skin and it would leave like a
Leave a
big
dimple.
divot
Yeah.
there. And I mean, not just for a second, but I mean, it would be there for like 2 minutes. You know?
Is that still happening now?
No.
No, oh no.
None of that.
I don't have
And
that.
totally zero in the wrist.
In the wrist.
Yeah.
A little bit in the
Right.
ankles.
A little
still,
bit in
or
the
no?
ankles.
Slightly in the ankle.
So we're addressing
no.
some infections in the kidneys. I told you last time, so that may help reduce that completely in this round.
Yeah.
You also said that you had lymph nodes that were swollen in the face and around the neck or so on. Is that
Mhm.
still happening?
I've had that all my life.
They weren't
mean, from-
swollen. They were
from the-
hard as
Hard,
rocks.
right.
Like hard rock?
They
lymph
felt
nodes?
like rocks.
Yeah. I mean, like the one under my neck, I mean, it was like that. And I mean,
Oh,
it was
that one,
huge and just hard.
But it felt like a
And
stone.
no matter what I did, I couldn't fix that. But
Like
yeah,
what
they're
did-
all, I mean, I can't even feel any here,
Mhm.
which normally they were out. Those are
Mhm,
gone.
mhm.
I can't, I mean, I can't even, I don't know, I think maybe you might have removed
They're
them
not gone,
when
but
I was
it's,
sleeping or
yeah, I
something.
didn't remove, no, sir. I didn't think you were- but their size has reduced dramatically to where they're normal now.
Oh, yeah.
But
Yeah, so
yeah.
what did you try before? Was there medicines, or did they do massage, lymph massage, or what were you doing?
Just antibiotics and
Antibiotics.
different medicines.
They don't even know what's in it, so how can they treat it
Right.
appropriately? Yeah.
No.
Right.
So, but now it's reduced. You also said that you had tingling, which was constant before we started
Yes.
working together. Is there any tingling in the body now?
No.
Totally gone.
Yeah, I don't have that.
Would we call, is it fair to call tingling like a pins and needles kind of
Mm,
sensation?
Yeah.
It does. It felt kind of similar to when your hand falls asleep
And then
lay
it's
on
waking
your arm
up
or
again.
something.
Mm-hmm.
Yeah,
And
similar
that's
to that.
totally gone
It's
now.
just a little bit different, but similar. Yeah.
And now it's gone.
Yeah,
No more
gone
of
now.
that. Excellent. You also said that you were dizzy. You would feel imbalanced.
Yeah.
And that was
Terrible.
happening. You'd be
Daily.
falling over.
Yeah, I mean, really. Well, it looked like I don't know if you've seen that Johnny Depp movie with the Pirates of the Caribbean. That's kind of, if anybody's seen that, that's what I was like.
What do you mean?
Like Jack Sparrow, he's always like.
Oh,
walking
right,
around,
yeah.
and I'm walking,
It's like,
I'm
right.
falling, and then, you know, and everybody's like, "Wow, he's drunk or something." And no,
And that wasn't.
I'm just walking.
And that's not at all. Now that sensation is,
Yeah. Oh, yeah. I don't have that at all.
He would
I
have to.
totally-
He would have to grab a hold of things to steady himself. He hasn't
Right,
done that
Right.
Totally
since
gone.
our treatment.
Totally
No.
gone.
Yeah.
Yeah.
zero.
Gone.
Right.
Totally.
Yeah. I used to feel like I can't wait to sit down because then I'm gonna feel safe. I'm not gonna fall over and embarrass myself.
If I can say something else that's more personal, you said there was a discomfort, testicular discomfort that you suffered for a long time.
Yeah. Yeah. Hugely. And I mean, I've tried to, and I've talked to, normal.
I get it, but you've been to different kinds
I mean,
of
you're
doctors.
abnormal,
But-
no doubt.
Yeah, but
But-
like a specialist in the
Yes, I
in
mean,
the testicular
mainstream
male
doctors.
Yeah.
genitalia area.
And I
that kind of-
say, I mean, just normal doctors that are just one form of doctor instead of
I
like
gotcha.
5 like yourself. But I mean, I have, I tell them, I've got a hernia or whatever and I need to have surgery. And they're like, oh, no, you don't have a hernia. I'm like, well, I need something because it hurts. It's
Mhm.
bad. And I mean, I've had that for years.
and they couldn't find any reason
No,
So
I
there
was
was-
I was so close to having surgery.
of taking out a testicle.
Of, I
What
don't
do you
know.
mean?
I
Of
don't
what
know.
surgery?
I was going to tell them actually in thought before the surgery, whatever you got to do.
Something, just help me.
Yeah.
But they couldn't
Well,
find
he was
anything.
scheduled for a hernia surgery, but it was going to be exploratory.
But they never
Because
did
In
they
nature.
could, they,
Because
they
there
were
was no
like, you
hernia.
have no hernia.
Right.
And
And
I'm
now
like, I
that-
have. I said,
And
I
now
got
that,
something.
and that was 10 to 15 years, you told me it was a constant testicular pain.
Yeah.
And now you
And
say
it's bad.
that's,
Hurting. I mean, I would say under normal circumstances, somebody would be almost debilitating, but I'm used to that. So it's like, yeah, I mean, I am,
How much better is it?
you told me the frequency was how much, 70% less, you
Yeah.
said?
yes, 70% less.
But the intensity
And the
is
intensity is also decreased.
30,
when I even
40,
have it.
50, when you have it. So when it happens, so sometimes now it's totally gone.
But there was no, like if somebody's been kicked hard there on accident or whatever, that's what I felt in one of them all the time.
Wow. And so now when you say, when it happens, so sometimes there is zero pain there now. I'm not saying, I
Almost
don't want
all
to
the
put words in
time.
your mouth. Now it's
all the
almost
time.
zero
I'd say
pain.
20% of the time is the only time that I have any kind of
Pain.
discomfort.
And the 20% of the time when it happens now, which is a dramatic decrease in the time.
Yes.
Yeah, it
You're-
sure is.
you're-
From my
you're-
end, it's real big.
Huge. And so your decrease has been, what was the less intensity of when that pain comes back? Is it as intense as it was before when it does come back that 20% of the time? Or it's
No, not at
decreased
all.
more than 50%, 20%, 50, 60%, what?
I'd say probably
40%?
50, in between 50 and 60 probably.
Excellent, that's huge.
It's huge. It is.
You also suffered from PTSD.
Yes.
And do you think that that was due to your time in the service? Or is that because of other things
It
going in
could
life
be
and the suffering of
anything.
the
I've had,
symptoms?
I mean, my career choices haven't been the smartest. So, I mean, I've done that. I worked in a really rigorous, fire and medic and everything. So,
Mhm.
so yeah, just, I mean, PTSD, I don't know.
The majority
I
of
can't
his
pinpoint
the
what it's
majority of
from.
his PTSD has to do with children when he was in the fire department,
Mhm.
and they would wake him up in the middle of the night often, and he doesn't awaken from it nearly as much as he once did, and sometimes he would yell himself awake, and he doesn't do
Yeah.
that at all anymore.
And so now he can sleep, and so that part of the post-traumatic stress disorder, the symptoms
The
of the
fatigue
PTSD
aspect
has
is
decreased.
certainly improved. Yeah.
Has decreased. The brain fog, so that's huge. So even people with PTSD, we can help with
Right.
that.
Yeah,
So it's great.
absolutely.
And there are some people who are very sick people in the service, whether it's through the military
Oh,
or
yeah.
through a firefighter or a police officer. I mean, there are people who are doing that public service
Yeah.
who we need their help, and they can actually have some pretty.
I mean, I think the media and the movies and stuff make it seem like a lot of something that's not. But I mean, you really are, even around people, and then there's, people are around you and they're moving and they're talking. It's just like, you just don't want it there
Mm.
at all times. You know what I mean?
You just don't want any motion, any noise, any light, any yeah.
It's hard to describe.
Right. He's certainly more social than he was 6 months ago.
I can see that right now.
Yeah. I mean, you didn't need me for this at all.
I know, I see that too. The brain fog.
When you got a beautiful wife like this, you can't. You
Stop.
don't.
Let's
You
stop.
don't like get on the video without her.
What is the brain fog though?
That
the same or is that decreased?
is probably the biggest. I mean, I don't know. I really can't say which thing has been the most helpful, but that's been huge. And my memory is just almost non-existent when we came in. It was getting to where I started to get
You would
concerned.
he would ask me questions in the same conversation multiple times, same question, as though he were in a different stage of life,
Yeah,
consistently, and that's gone.
and we were,
He's almost
it was-
remembering too much
yeah.
for my liking.
Yeah.
So it's great. So the brain fog is gone. You also told me that he had, and you were misdiagnosed as a Parkinson's disease
Yeah.
because you felt shaky,
Mhm.
and the doctors misdiagnosed you,
Mhm.
and it wasn't Parkinson's. And that shakiness, was that all the time, Mrs. Nemeth? Was that
Oh
all the
yes.
time in him?
Oh yeah.
You
Yeah.
could see it and feel
I
it
could
in him?
feel it. I could.
feel it.
We couldn't always see it, but I could always feel it.
And
And
so,
absolute misery if I didn't take medication. I mean, absolutely.
And he was at the absolute
Misery.
height. I mean, we couldn't take a
Couldn't
higher
take any more
dose.
meds.
No,
but it wasn't getting rid of the
it
problem.
wasn't getting rid of the problem.
And now,
I mean, well, I mean,
is there
this-
any of that left?
I mean, there is some left, but I mean,
Could-
it's been years since I've been where I
Yeah.
have thought, oh, I forgot to take mine. It's not like a medication you forget to take.
Your
What was
body
what
won't
was the
let
name
you
of-
forget.
What was it? Can I ask? the name?
Ropenetrol.
Ropenetrol is the one that
The body won't let you to forget to take it because you know you're feeling so strange inside.
And then it takes a while. I mean, it takes like a good hour and a half to
And
start affecting you.
So now
you're like, you don't
you've
forget.
you forgot. I'm sorry.
Uh-huh.
It's affecting you before. You don't forget to take it. I'm
Yeah.
saying before you would never forget to take it because you
Right,
knew
'cause
it
it's
was
so
bad.
Because his
terrible.
body would feel so
Yeah,
bad.
right. Now I'm forgetting it for a different,
You're
not
forgetting it
because my
because-
memory's bad or anything, but I mean,
because you
it
don't
doesn't
need
affect me that badly.
Right.
No, because the symptoms are not so bad, so you don't need it so much,
Exactly.
right?
Exactly. That's
So you won't need
exactly
it.
right.
So that's
Yeah,
tremendous. I mean,
yeah.
it's
So
tremendous.
yeah,
It's
thank
huge.
you for that. It's really
You're
been
welcome.
it's very helpful, very nice.
Is there a way to quantify? And you also, I'm sorry, there was some other symptom here. There was numbness that was in the body. Is that still there? There was numbness.
I
at the
don't
same
think so.
time.
I think the
No.
numbness and the tingling and the
It's
Raynaud and
almost-
it's all gone.
I mean, you've helped me so much that really, in that short period of time, how many days has it been? When did we start the treatment? How many days? has it
I
been?
saw
Like-
you June 11th, so we're talking 3 months ago,
Mhm.
and you probably got your protocol
Yeah.
to start at maybe a
Week
week
and
or
a
so
half,
after, or
yeah.
something like that. So
I
10
mean,
days
my
later.
memory and brain fog and everything were seriously bad, but I mean, I
You-
got to where I came in this time and
It's
you
not
started
even 3
telling me
months.
my past symptoms. I'm like, oh, I totally forgot I
you
even
forgot
had
about
that.
the symptoms.
Yeah, I forgot I had that.
Yeah.
You know, I mean, then I'm like, oh yeah, that was awful.
2.5 months ago, you started. The last time you started your protocol 2.5 months ago.
Hmm.
You didn't have to come back here for care.
No.
You took remedies at home. They're pretty easy to do.
Non-invasive.
Especially your wife was able to organize the calendar and follow it to make
It
sure
was
that you got
super
it.
simple, yeah.
Super simple. And so
Very
it wasn't
helpful.
too much effort.
Nope, it was
And
super easy.
easy to follow. Totally different
Right.
kind of science, totally
Just
different kind of
everything.
exam.
Yeah.
Depression, huge difference in that. We hadn't,
Depression.
Oh yeah, we hadn't even discussed
we hadn't
that.
discussed that,
Tell me.
and I didn't realize it until just this very moment.
This is
but
wonderful. Please.
His
I
depression.
don't know
was
what to say.
I mean, he's been taking Wellbutrin
the depression.
since the Marine Corps.
We've got I have so many other normal, what you would think health problems. Oh man, he can't even walk. He's been kicked in. But so I hadn't really thought about the depression really that much. And I
It's
guess
true.
I just left you out of the loop on that. But you fixed that too.
You mean it's
Yeah, it's
like gone.
Well, it's hugely less.
I wouldn't say it's completely gone.
No, it's definitely not completely gone, but you.
But his
made
ability to
such
pull
an impact
himself
on
up
it.
out of it exists now, and there was no ability to do that before. Because now he can get up and go be active.
Right.
So there was no way to produce the happy hormones that you get from exercise when he couldn't exercise.
I mean, just look at the fact, you can tell he's not so depressed right now, but all
Yeah.
the laughing and the smiling that's going
Yeah.
on right now.
Yeah.
Isn't it
I mean,
amazing?
Yeah.
Yeah.
Amazing.
I mean, he was really depressed.
And what are but now when you say not totally so, can you quantify how much improvement, if we could say it's 70% less depressed or 30% less, is huge, Steve, 30% less depression, is 80% less depression, is there a way to quantify that at all? And maybe it's not, but you just feel just greater. now.
Maybe. It's probably at like maybe 30% of what it was.
So 70%.
I mean,
of
so
it.
it's
70%
gone down
relief.
quite a bit. Like when I was seeing, my primary doctor, I'm seeing him for all my pains and all these other things, and he's like, "Why aren't you coming to see me? Why do you wait?" And but he'd say, "How depressed are you? You're depressed. You have depression." I'm like, "Oh, I don't think I have that." And he'd ask me questions. You're like, "Well, how often do you think about whatever, suicide or something?" I'm like, "Well, doesn't everybody think about that all the time?" He's like, "Ah."
Did you ever feel like saying, well, the reason why I'm not coming is because
You aren't
you're
fixing
not
it.
helping me? He might be a nice person.
I never.
Maybe he didn't want to hurt somebody's feelings, but I
I
mean,
never
was the
really,
reality? The reality was.
But
that
really, it was just my job forced me to have to go to the doctor so often. And then I'd go, and he'd be like, "Why aren't you coming when you have? What do you mean?"
He didn't actually ever believe
But
he
the-
could be helped.
He didn't believe he could ever.
He
Be
didn't believe he could be
Just
helped
It was
by
just-
anyone.
All
Right.
these things were just
Medicaid,
normal
just
life
tried to
for
kinda
me. I
aid
mean,
you.
it started when I was a
Right.
teenager. And
Right.
they
I mean,
lasted
he
till now.
like when I found you.
Wait a minute.
He came.
Strike that from the record.
When I found you, he came just, I think, because of my enthusiasm, not because he actually thought anything was going to change.
Yeah.
And then when I started talking to him about the science, and he, then he started to,
I
it
wrote a
started to
song
make
about
sense. He wrote a song about it. Then it started to
I
make
was
sense to
blinded by
him.
it.
But
But you kind of,
Huh.
he just went along, but to actually feel, to experience the changes
Right.
you're experiencing,
Yeah.
there's no way that you can actually look back and say, oh, that's not real.
he feels so much better. He
Right,
doesn't
it is.
remember how bad he felt.
Right. Well,
I
I mean, if that's not an indicator of
it is. I mean,
improvement.
I started going downhill at 13, but then we met when we were like 17, 18.
first time.
And I mean, she would say, "Yeah, I think well, she used to say, I think you're the funniest person I've ever met." And now, I don't know. I just haven't been that funny for a long time. So now, I don't know. How funny am I?
No pressure.
What's the percentage?
So, overall, there's a dramatic improvement. You're pretty happy with what we're doing.
Thrilled.
Yeah. Oh, yeah, yeah.
Thrilled.
Thrilled.
Yes, incredibly.
Thrilled.
You're getting your life back.
Yeah, I think.
So
I
you
never got any help from medicine, and I just didn't think there was anything that was going to help. Now my wife is brilliant, and she is a medical. I mean, we both were in medicine, but I mean, she's brilliant.
You are what did you do in the hospital where you worked?
Me?
He's
Yeah.
talking to you with the credentials.
Oh, well,
What did you
I
do in
mean,
the hospital? What did you do? What do you know?
Tell me all the initials
I
after
mean,
your
I
name.
have-
Hold on, you got a
Stop,
couple of
the
initials.
pressure, the
Not just the
pressure.
last name
Okay.
initials.
So no, I have my first degree is in radiography, and then I did what you did. I took classes in what I liked and what I thought was interesting and what applied to him.
Okay.
So I mean, really, I started thinking about all this stuff with my son, who had motion issues
Mm-hmm.
and sensory issues, and then it just naturally
got into trying to help them
Right.
figure it
So,
out.
you know, I'm a member of the College of, American College of Rheumatology and
Which
all
doctors
these other.
can't even get into, as you know.
But
I mean,
it's only because
she is-
I had the right people write the right letters, but only so I could get to their resources. I mean, that's all about. If you
so
can get to the resources.
reason I bring it up is because we exhausted everything medicine could do, and we found all kinds of, gadgetry and treatments and stuff, which were helping to an extent more than medicine ever did. But it got to where I started to get to where I was
couldn't
leveling
hold
out
it
like
back
Like I
anymore.
was starting to. I felt like,
Go back down.
Right.
and we couldn't come up with any more stuff. So,
And
that
I've been
was it.
watching. I watched you for a year.
and
Yeah.
I didn't know about that. I was really upset about that.
It is recording right now. That is recording. Okay.
Well, I mean,
You're obviously on go. I mean, so. I mean.
She was only watching for the benefit of you.
Right, I
Yeah.
just said yes. Yeah, we were actually both watching,
Yeah.
just to,
right.
the same
But
intent
I mean,
and the same
everything. The
purpose.
clean water. Making sure the nutrients that were
Right.
getting into his body were actually nutritive and they were actually
But you were
working.
trying to-
It was all about trying to hold it back. It was keeping the
And
storm
we
back.
really did. I mean, we really thought we were like, whoa,
It's
geniuses.
working,
And
right.
then, we really did do well, but then it got to where I knew it was, and I thought,
You weren't going to get that.
He
Not
knew
good.
he knew he was going to be dead in the next
Yeah.
5 years.
And so
he
now
was
there's
sure.
dramatic improvement.
yeah.
Dramatic.
Is there
Right.
is there anything else? He really stole the show the whole time.
He did.
What?
Is there
You
anything
didn't
else
need me
he
at all.
has? Look
I
at the
told you you didn't.
personality
Come
back.
on.
This guy, this was not
See,
day
all you had
one.
to do is
she
turn on
I
was-
the
didn't
camera,
even fix
right?
my hair before this.
Day
thing
one,
started.
she was the one who took over in the consultation. He had no
Right.
discussion.
Well, he couldn't talk for
Is
himself
there anything
then.
else that you want to share?
That I want
Is
to
there
share?
anything else that you need to share?
What? Yeah. So
I know-
I
just say
think
one
you
thing.
any
are
kind of medical
brilliant.
stuff I haven't
That's
said,
what
you
I
go
want
ahead
to share.
and say. What do you,
I think he's brilliant.
if anybody needs help, what do you want to tell them about?
He is brilliant.
He is, and I mean,
Brilliant.
she's always thought me pretty smart, and and really, there's nobody ever that she says, "Wow, he's like as smart as you," and I
Yeah.
think she said he was smarter than me.
Wow.
Which I don't
Well,
know. I don't know about that.
Anyone who knows us has heard me say he's the smartest man I ever met. And he is. He is a genius.
Well, like if you've ever
That-
been to a really good medical doctor, like somebody went to, Harvard, they fixed a lot of people, geniuses, moron. Come see this guy,
Yeah,
and you'll realize
yeah. American
He's not paying
medicine
me.
is not there
Not paying
to
me.
make you well. American medicine is there to keep you sick. Period.
Adrian Kaufman.
Indeed.
It's like,
It's the truth.
yeah, oh yeah, absolutely.
But you've
Our
actually
water
said
is
that.
poisonous. Our food is poisonous. It is the
Our medicine is
it's the
poisonous.
sickness. It's the sickness
But
industry.
you've
It's
even
not the
said that
wellness
your
industry.
neighbors have even noticed.
Oh yeah,
My
everybody.
neighbor has prostate cancer, and we kind of been like, everybody's like, oh, these are two
Well, he has
sick
cancer
guys.
in his prostate.
Everybody stops and gives
Right.
us, talking, pep talks and food and whatever, and they're like, they're sick. So
Right.
then he's been saying, what's going on? You're like mowing your grass and, outside playing catch, and
Yeah, because our yard was
I was
looking
like,
like
Dr. Herman. And so, he'll probably be the next one up here. He's pretty excited about it,
Yeah.
actually.
Excellent.
Well,
Excellent.
we're bringing the whole family,
Excellent.
one at a time.
I'm happy to be part of this recovery.
We are so thrilled.
You've actually shown me much more in this few minutes that we've been here than we had before the discussion today, before the exam today.
Well, I
Well,
totally forgot
once the
about
camera
depression
came on, he
thing.
remembered all kinds of
He
stuff.
did. It is great, but
Well,
I mean,
was
literally
going to be in silk stockings.
thinking of, yeah,
But I just turned it down. I really was.
Stop
thinking
it.
of, if you really saw it, and I can only tell you in all seriousness, if you only saw what he was like, what his personality was like, what his face was like, what
Yeah.
his expressions were like, or lack thereof, any expression, the first day that we met
Yeah.
back in, it was May or June, he was a total, really, it was like a zombie. Looking
Yeah,
at you, you
absolutely.
were like a zombie.
I really didn't look at myself much, but I know when I walk in a room,
You couldn't
everybody's
even,
kinda like,
it was just
"Ugh."
directing you to do something. You were really
bring
in a,
us down.
you were pleased, you were really in a
Yeah.
place of like not even comprehending, can you go piss in a cup in the bathroom? And it was like,
It's true.
Right.
what?
Yeah.
Right? He had to
I really
consider
did.
it. I mean, he
Yeah.
thought about it for a couple
I
minutes.
did
before.
because I was like, you gotta like bend the cup and put it in the vial, and I was like,
What? That's too much work for me. How do I do
I don't
that?
know.
I mean, think of this, finding mosquito-borne illness infections in the nervous system. that they're not finding with a blood test. Dengue fever virus
Right.
in your brainstem, in
Right.
your adrenal gland, not letting your adrenal help you produce cortisol for more energy.
Which makes you happy.
Lidocaine,
Yeah.
local anesthetic chemical in the brain. What is that doing to the brain? I mean,
Mm-hmm.
dengue fever in the brain also. The anesthetic chemicals in the cerebellum, Lyme infection in the stomach, dengue fever infection in the stomach, just to name a few.
You started making
And
me feel bad again.
no, you're getting
No,
better.
I'm just joking.
And the other infection findings that I discovered today, which I'll try later on to make up another video, and maybe about those kind of findings, which are just really incredible. I mean, finding all these different influenza virus and dengue fever and West Nile virus and Lyme in your lymph, in your spinal fluid, in your brain. I
He's
mean, it's
been in
just,
jungles all over the world.
it's just incredible.
We've had every blood test there is. No one
Nobody's
took us
ever touched
seriously.
it.
Nobody took us seriously.
And here it is. He's a new man. You got him
I
back.
am.
You got him
I
back.
feel like a new man, but
Better
I don't.
than-
You know, I think I've still got more to go. I mean,
You do. And you're going to be even better than this. And hopefully you'll both be willing to shoot another video. So this is not the end of all the treatment, even though it's such a dramatic improvement in function, dramatic improvement in personality, dramatic improvement in cognitive function,
Yeah.
and dramatic reduction in symptoms. And we're not even done with this. That was only after the first protocol. The speed of recovery varies from person to person. So we can't all expect, we can hope, I do expect you to get better, but we can hope to get better this fast. And the better I get with my work, the better, and which is all the purposes to help sick
he's
people get better.
constantly.
Improving.
I'm looking to improve.
Yeah.
Yeah.
Thank you.
Really.
Yeah.
Yeah. So it's all about this getting sick people well.
The-
And seeing it happen really
you,
fast.
I mean, you really couldn't put a dollar amount on the value. Is so, it's worth so much more than we could even explain.
Yeah.
I mean, you've given us quality of life. You've given the whole family quality of life.
And wait until after this next round. Wait until after this round. It's going to be
Yeah.
even better. So hopefully that we can give an update after this round and be able to show
Yeah.
you know how much more
Not to
improvement
mention
there
how
is.
good the yard's gonna look.
We don't look like the Clampets anymore.
Yeah. All right. So thank you very much for sharing with people.
Mhm.
And so they can know that people can really, with chronic illnesses and chronic pain and chronic malfunction and chronic brain fog and memory and all this, you can get better. We just have to know what to do. And you've got to be, doctor has to be functioning as a multiple practice kind of physician all in one. And that's the only way it's going to work, and be able to use methods that work to pinpoint and safely remove the chronic hidden infection diseases, the infections and toxins causing the disease of the entire central nervous system. And when we can get it out of there safely and effectively, it's just, I mean, life is coming back. These are two real people giving a real life story about their real life
They are
experience
real. No
with me.
unreal people were using them.
And it's not, they're not paid, and this is real.
Yeah,
So you
absolutely.
can get better. There are real sufferers and no longer. So I thank you for sharing this.
Thank
you,
you.
Doctor.
The personality has really come back. Wow.
Thank
Yeah.
you so much.
You can call my clinic if you also want to get better, and there are people who come to my clinic literally from around the world, as well as across the state of Florida and across the United States. So you can contact my lovely clinic assistant. She's very happy to help you make an appointment and help you arrange appointments here and to be able to find where you can stay and so on. And but call my clinic at 954-370-3100. That's 954-370-3100. I'll also put the email address to contact my assistant at the bottom of the screen here as well. And just as soon as you're ready to get you or your loved one who's sick, to help you or that loved one get better, you call us, because I'm sure we can help you get the job done, or you have a high likelihood of getting the job done here and a pretty rapid pace. Okay? Thanks again. And that's anything else? We're
Thank
good?
you so much.
Okay, you're welcome.
Thank you.
You're welcome.